surely want to know more about cancer and how this is a wake-up call and how holistic healing can affect the cancer. First of all, Dr. Laura, I want to ask one question from you that usually, I am also from medical school, that
Mm-hmm.
very few doctors are there who think about holistic health. We always think about medicines, surgery, radiations for cancer, but only few doctors are there, or we can say that only in few doctors which can be counted on fingers who feel that yes, holistic help helps in cancer. It is both curative and preventive also. So how your journey started?
Well, Sanjeev, this is a very good question. I think a lot of us start because of a personal journey, because of a personal event. I'm not saying that everybody, but I feel that when one goes through something personal, then the experience comes from inside, and then nobody else can tell us, that it's different. And for me, it was a question with fertility. It was not with cancer. It was, I had climbed the ladder of my professional life up to where I wanted. I trained in Sloan Kettering Cancer Center in New York. I spent 8 years doing clinical research and translational research in Switzerland. But when I decided I want to settle and have a baby, I couldn't get pregnant. And this wouldn't enter in my mind, Everything I wanted, I had achieved. And in my own body, I couldn't get the results I wanted, and I didn't have anything organic. So I followed the medical advice and I did all the treatments and everything, and I couldn't get pregnant. And so for me, this was my wake-up call. I said to myself, there must be another way of inhabiting this body, because so many women get pregnant. So why can't I? So for me, at that moment, I started yoga. This is why I owe so much to India and all your wisdom, because all these practices that you've known for ages, and millennium, and which are so important for regulating our body, for auto-regulating, not even saying for a spiritual evolution, but just if we only look at the physiologic effects. So I started yoga, and this allowed me to start getting to know my body, listening to my body in a different way. And this was my journey. This led into a sabbatical year where I went to India for 3 months to learn more about all this, and eventually I came back home to Argentina and decided, how can I put this together with all the medical background I have? How can I put this together in my professional life? And this was the starting for me of this integrative medicine.
Superb. Here I want to know one thing more, inquisitive question, that which places in India you visited and what things you learned from different places.
From India?
Yes.
Oh, I went, I went twice to India. The first time I went for business. So for me, it was when I went to these big hotels and everything, and I said, no, I'm not getting to know the Indian people. I want to get to know how they live, their food, everything. So the second time was after this wake-up call. I was lost, and I had to find myself. And there I went for 3 months. And I went from the south to the north. And I can tell you a million experiences. Very nice experience, very enlightening experiences as well. And some treasures I keep in my heart. One is this ashram in Tiruvannamalai. I don't know if you pronounce it like that. Of this lady guru, or this lady teacher, Shiva Shakti, who, she didn't preach anything. She just opened her doors and let you go there to meditate in the morning and in the evening. So her teaching was, just go inside, go and find yourself. And she just came and she had a very intense look, you know, and a very, very impressive presence. So she just came in and she just looked at each person in their eyes, and that was all, you know, and the atmosphere was there for you to go within. So for me, that was the best teacher of all I heard, you know, no words, just presence and letting you, allowing you to go inside. This was a treasure. Another treasure, like I would put, it was going to, I ended my trip in Dharamsala, and the Dalai Lama was there at the time. So it was a beautiful experience with all this people, you know, this monks on the streets chanting and praying. The atmosphere was incredible. So yeah, and I have a million more, but those are like two true little treasures.
Yeah, thank you, Dr. Laura, for sharing your experience in India. Everyone want to know about the Cancer as Wake Up Call, and over to you.
Okay. Thank you very much. Thank you, Dr. Ranjan. Thank you, Dr. Sandeep, for this invitation. So I prepared some slides, and I'm happy to have some exchange. If there's something that is not clear or there's questions, I'll keep my chat box open. So if people want to chat and make questions, that's fine for me. Or if you want to coordinate the questions, that's fine for me as well.
Sure.
So
you can share your slideshow, Dr. Laura.
Yeah. You let me know if you can see that.
Yes, we can see that.
Okay. So I'll try to make my talk in the simplest language I can, because I know that the audience may be diverse. And I kept, you know, good references in most of the slides, so people who want to go deeper, they can look at the presentation again and go deeper into the references. So this is a short summary of my CV. Again, all my gratitude to India and all that India has given to me. I really learned a lot from you, from people in India, and your culture and your spiritual wisdom. So I don't have any conflicts of interest, except that I am going to talk about my book, Cancer as a Wake-Up Call. And this book came about from my experience. At the time, it was my 7-year experience practicing as an integrative oncologist and seeing many people take the cancer diagnosis really as a challenge, and allowed to be waken up, shaken, and stop and see how they were living, and start a new way of living, a more healthy and more happier way of living. And I will share with you some of the cases which are doing very well, and this is what I have to share. So for me, this journey, it was my personal journey, and for me it was important to find my own truth. What had meaning for me, because when I was in Switzerland, after training in the States, I was in Switzerland working in research, and I was head of a team in a pharmaceutical company going to look for new molecules to develop as oncology drugs. What I found is that the people that I was interviewing in biotech companies or in your university research labs were people who were really basic researchers, who understood a lot about basic research, but had no idea of the clinical setting. And I had the impression that we were looking for the cure in cancer, looking through a keyhole, just looking at a little part of the problem. So this is how I started my journey and took my sabbatical year and wanted to understand life from a different, more encompassing way of looking at life and at a human being. And that's how I came to integrative medicine. So we know that cancer, it's not a new disease. This is a papyrus from 2200 before the current era in Egypt. But we do know that now it's becoming an epidemic in some countries. An epidemic in some countries. Countries that are colored in darker colors shows a higher incidence of cancer, which are mostly the countries where we live this Western type of life. Europe, North America, South America. That's becoming very close to North America, and Australia. And we see other countries like yours and some countries in Asia who have a much lower incidence of cancer. So clearly the World Health Organization has established a relationship between cancer and higher incidence of cancer and lifestyle. So the incidence is so high that it's estimated that 1 in 2 men and 1 in 3 women in Europe and in America will have cancer in their lifetime, sometime in their lifetime. This is huge. This is nearly half of the population. And this is not getting better. The projection is that it will increase by about 70% in the next 2 decades. So my proposal with this talk is that we need to start thinking about cancer in a different way, because that's the only way that it gives us a way of dealing with cancer in a much broader sense. So for now, we've been saying that cancer is a term that it's used for diseases in which abnormal cells divide without control and invade nearby tissues or can spread to other parts of the body, even putting at risk the life of the patient. This is a NCI, National Cancer Institute of America definition. So this definition comes from 1858, where Dr. Virchow described the cellular theory and said that if a cell has a disease and that cell divides, it passes that disease to the daughter cells, and so on. So an accumulation of diseased cells is grown, and this is the theory that was postulated more than a century and a half ago, and we're still repeating the same model. Even though medicine has advanced and technology and science and physics and our view of life has advanced a lot, we still keep postulating the same theory and basing our treatments in this model, which clearly has become obsolete. So on one side, they tell us that 50% of the most common cancers could be prevented if we ate better, if we kept a good weight, if we did exercise regularly, if we didn't smoke, if we protected our skin from the sunlight rays, if we got vaccinated from against certain viruses that are related to cancer. So if the problem was in that dividing cell, we couldn't be preventing all these cancers if the problem was only on the dividing cell. So this means that there must be another way, something else that is needs to be integrated in this equation to understand how to prevent and how to treat cancer. Because the model we're using is keeping a lot of these questions unanswered. Nowadays, why do people that smoke, not everybody gets cancer? Or why do they get cancer maybe when they're smoking or 20 years after they quit smoking and not when they are smoking? So how do we explain that? Or how do we explain that 2 people with the same cancer diagnosis, the same stage, the same prognostic factors get the same treatment and do completely different? So obviously there are some other factors that need to be integrated in this equation, and it's not so linear. It's not that cancer A goes like this and cancer B goes like this, because we see in the clinics that this is not the experience. And more so if we look at other specialties in medicine like cardiovascular disease, and we see an increase of heart attacks after an earthquake or after the final match of a big global competition, one of those World Cups or something. And we see that there has been registered like increased ER visits for heart disease after a team has failed. So how do we explain how emotions are affecting our own body? In our current medical model, we don't. And I mean our current medical model, I'm referring to the current Western model. Please take into consideration that I'm talking, you know, I've been born and raised in what we call the West, in the Americas. It's South America, but it's America, and trained in the States and Europe. So it's a very different mindset than many other people have, for example, in Asia, where their culture is different. But I understand that, for example, you in India, your medical school follows more the Western,
same
model.
So same protocols.
So I'm not talking about I'm talking about Western medicine and people that follow the Western models, but I know there are other medical models like the Chinese model or the Ayurvedic model, which are completely different and can answer a lot of these questions because they look at a different in a different way. So Thomas Kuhn last century explained that when a model is in crisis, when the model we're using, it cannot answer all the questions we're having, then we enter into a real scientific revolution, and we need to find a new paradigm. And I feel that that's where we are. And we are there, and still our medical schools are teaching with the old paradigm. So this is why you ask, you know, why you say, why so many doctors still don't understand or don't adopt or are not agreeing with a holistic view, because they have been taught with the old model, with the mechanistic model, and that model, we know that it is in crisis. So let me tell you a little bit about this new model or this changing in paradigms, and we're still in the midst of this. If we in our Western world, we share the experience of Copernicus, who was the first one who started saying that it was not the Earth in the center of the solar system, but the sun. And it took 100 years at that point to adopt this new paradigm. So I'm not saying it will take 100 years for us to change our paradigm in medicine, but there is an inertia of people who have been trained in the old paradigm, and we still need some time, you know, to adopt the new one. So Thomas Kuhn, what he said is, it's not a question of, you know, disposing all the knowledge we have up to now, but what we need is a different view. It's looking at the same data but from a different view. And he made the point showing this diagram. He said, if you look at this picture, is it a duck or is it a rabbit? And it all depends on how you look at it. So this is his proposal, that we look at the same disease and the same disease process in a different way. So let me try to seduce you to, or invite you to think about this new paradigm, which is not about just a change in, you know, it's just changing. I'll talk a lot about the psychoneuroimmunology paradigm, and it's not just about the psychoneuroimmunology paradigm, but during the last century, there are several theories that have come up that really are changing the way we're seeing life. And we should apply these to medicine as well. So one is the complexity paradigm. And I will briefly talk about each of them and how they are affecting our view in medicine. The other one is the systems theory. The stress theory and the allostatic load, that's a huge theory that we need to integrate in our pathophysiologic explanations of how we get sick, and the chaos theory. So just to say a few words about each one. So the complexity paradigm tells us that we cannot continue thinking about factor A plus B equals C. We cannot continue thinking in a linear way. It's not only smoking that causes cancer, it's smoking with some other factors. And this explains why people who smoke get sick, get cancer, and some don't, or why people who smoke get cancer 20 years after quitting. So, so this is the first complexity paradigm, tells us about a multifactorial. We need to look at many factors at the same time. And also this paradigm is very interesting because it tells us about the concepts of equifinality and multifinality. What it means is that people might have the same final result, but they may come from different paths. So I explained this by saying 10 women may have breast cancer, the same stage, the same type of breast cancer, but their way to getting to their cancer may be a very different one. One may be because of hereditary risk factors. Another one may be because really a poor taking care of their body, poor lifestyle. Another one may be after a very intensive and traumatic years of a lot of stress, and all these factors. And I'm not saying it's one factor, but we will see in some examples how there are major factors that play a major role, and then there's some other minor factors. So we need to look at, so these 10 women may have the same cancer, but they need different treatment. They might need the same surgery, the same radiation therapy, hormonal therapy, but what led them to get sick needs to be balanced. And in that sense, they need a different treatment, each of them. So the systems theory also tells us that we are part of we live in a systemic type of structure. So in every system, there's different levels of organization with different functionality. So we think our cellular level and molecular level, it's one way of functioning. But as soon as those cells come together and form a tissue or an organ, oh, I'm sorry, this is in Spanish. I didn't realize I left my slide in Spanish. So as soon as the cells organize in tissues and then in organs, then there's new structures and new functionalities that emerge. And then the organs and systems form a human being, and then many human beings form a community, a population and a community. And what this theory says that if something is affected at one level of the system, all the other levels will get affected. And clearly we can see nowadays that if our community gets affected, we are affected. And it's probably that at our cellular level will get affected. And let me make just one parenthesis to say that nowadays, and all my sympathy and my compassion for everybody in the world who's suffering, but I know India is going through a very difficult time nowadays with the COVID. We had them in our news in Argentina yesterday. So obviously, if our community is suffering and we're being, we have sorrow and we are preoccupied and we are in fear, that will affect, and we will see now, according to the PNI, how it will affect ourselves and even our internal organs, because if we are in fear or in anguish, we will be producing stress chemistry inside us, and this will be affecting our organs. So it's very important to understand that wherever we are, the environment where we move, how the environment is at home, at work, the people we talk to, the information that we take in every day, it will be affecting us. And even if we say, no, I live isolated from my community, I have nothing to do with my neighbors, no, we're still affected because we're still part of a whole. So this we need to understand, and whenever there's something affecting one level of the system, it will affect the other levels, or it may affect, and if we raise awareness, we may do something to counteract the effects and try to keep the balance, even if we are going through a difficult time. So this is the system theory. And what it tells us also, even in adult medicine, we need to look at that adult within a social group. We cannot look at that adult as a single person isolated from whatever is going on in where they're living or where they're working. So the other big theory that came about in the second half of last century, is Hans Selye stress theory and allostatic load. And what he says is that we have this incredible mechanism, adaptive mechanism within us to be able to answer, to give an answer to whatever demand we are experiencing from outside. So life asks us, demands us to get up and go to work, demands us to take care of the children, demands us to, I have to run because it got late and I have something to deliver. So those are all demands. So we have this incredible adaptive mechanism inside us, which is this autonomic nervous system, part of the nervous system that doesn't need any directions from our cognitive, from our conscious brain, but it goes in automatic, in autonomic. And what it'll do is, if we have a demand, instantaneously it will prepare us to, it will prepare us and our body to give a response to that demand. So that is how we can adapt to give response. So for example, I realize that it's late and I have to run to get somewhere. So inside myself, I will be pressing, without thinking, I will be pressing like a gas pedal. If you're in a motorbike or in a car, you have the gas pedal and the brake, the gas pedal and the brake. Okay, inside I will be pressing on that gas pedal, which will instantaneously activate a whole myriad of activities within my body to prepare me for action, to prepare me for demand. So my heart will start beating faster to get more blood to my muscles. The blood will be recirculated, so wherever I don't need it, in the digestive system or in the reproductive system, in that moment, it will go where it will go, to the brain and the muscles, to think, to take decisions and to act. The sugar will go up, so I have more energy, etc., etc. So this is the stress reaction, and this is an incredible reaction we have to put up with acute stress. But the normal, in order to keep us healthy, what we need is, after the stress pedal has been pushed, then we need to press the brake pedal in order to come back to a balance again. And this is what it's shown in this cartoon. So as we press that emergency button, but then we need to come back to a stable position again. And the problem is that nowadays we're living with so many demands that we're pressing that demand pedal, that gas pedal, all the time, and not letting time to come to rest and to balance again. So we keep accumulating this stress within us, which is called this allostatic load. What happens is that it's like carrying this big, heavy load within us every day, because of whatever we carry from the day before and the day before and the day before. So our ability to respond becomes more and more tired, more and more exhausted. So we are at the long run, we are less capable of answering, to give an answer to demands. And this is when we get vulnerable to get sick, because our system shuts down and says, I cannot answer any more demands. So this is physically what happens in the stress response. And here in this slide, I explain what it happens chemically. So that demand, what I'm talking about, pressing that gas pedal, is like activating all the sympathetic route and producing adrenaline and noradrenaline in order to activate myself with increased heart rate, increased blood pressure and sugar and everything, in order to give an answer. And at the same time, our hypothalamus will be activated, and it will reactivate all the hypothalamus, pituitary, adrenal, HPA axis, producing cortisol. And cortisol will also add, as I said, to glucose mobilization, intravascular volume, etc. So the three main hormones are the ones that take the information of the stress reaction into each of the cells through the chemicals, through these chemicals, cortisol, adrenaline, and noradrenaline. So this is an excellent mechanism, because very rapidly the information gets to the cell. But The problem is when we keep pushing on that gas pedal again and again, and then we have raising levels of cortisol, adrenaline, and noradrenaline in our system, and especially cortisol, which is very in the chronic, in the acute stress reaction, it may be very useful, but in the long run, it affects a lot our immunity and our capability to respond to external demands. So basically today, what we think is that cancer is not that cigarette causes cancer, but it's extreme environmental pollution with carcinogens like the cigarette smoking, but also like sunlight through this ozone holes that we have. We get more straight sunlight, and a lot of the chemicals we get through the food, the pesticides, radiation material that are bombarding us, and our immune system has to be keeping us away from those or cleaning them from those. But if at the same time we're living this very demanding life, we are not able to get to balance and repair the cells. So it's a combination. We think that cancer is multifactorial in the sense that we're living much more bombarded by pollution and living in a stressful way, which does not allow us to heal. Therefore, this is the lethal combination. It's not one factor, but it's a combination of being more exposed to carcinogens and living a lifestyle that does not enable our immune system to work properly. And this, we know it scientifically, we know it because high levels of cortisol and other corticoids will inhibit our DNA repair. So if we get in contact with a pesticide that is carcinogenic and one normal cell mutates into a cancer cell, normally we have this repair mechanism. After DNA damage, we have this repair mechanism that will avoid the formation of tumor. But what happens? Corticoids inhibits this repair mechanism, so we can no longer repair the cells. So the cell starts multiplying and leaving that damage to their daughter cells. And at the same time, the sympathetic system will activate the innate immunity and produce chronic inflammation. And chronic inflammation will have a positive feedback mechanism producing more DNA damage. So by both ways, by the cortisol and the adrenaline or adrenaline and the sympathetic system will be feeding back that loop of DNA damage and inhibiting repair. So more cells are damaged, more cells are turned into cancer cells, and more cells continue dividing because nobody repairs them. And when there is chronic inflammation, I will see it, I will look at it, there is decreased cellular immunity, which is what we need to eliminate those cancer cells. So again, we know that stress response through the HPA axis and cortisol will activate all the inflammasome through NF-kappa B, and at the same time through the sympathetic chain will cause chronic inflammation. So chronic stress causes chronic inflammation, and we know nowadays that systemic chronic inflammation is the basis, the physiopathologic basis for a lot of the modern chronic diseases, not only cancer, but also cardiovascular disease, depression, autoimmune diseases, neurodegenerative diseases, Alzheimer, sarcopenia, osteoporosis, etc., etc. And what gives this chronic inflammation in a major way is this chronic stress that we've been talking to, but we will see how some of our lifestyles also adds to that chronic inflammation. So this is very important to understand, because when we get any of these diseases, cancer, cardiovascular disease, we might attack the symptom. We might give medications after a heart attack or for hypertension. But if we do not ameliorate our lifestyle, then we will keep on producing chronic inflammation, which will feed more and more of the disease. I think this is clear in this picture.
Yes,
And you
very
have
clear. It's very clear, Dr.
So, and we know now, and for people who are in the cancer and the oncology area, we know now that inflammation produces a myriad of cytokines and substances which will continue damaging the genes and the chromosomes and creating this microsatellite instability. And the tumor will go on diversifying, mutating, so it becomes more resistant to drugs. And we keep on, changing the drugs to adapt to the changes in the tumor. But as long as we don't stop the inflammation, the cancer will be, like we see now with the virus, it keeps mutating. The cancer in the same way keeps mutating and producing new forms that are resistant to one treatment, and therefore we need to look for more treatments. But again, if we don't treat the root cause, which is the inflammation, we will not stop that cancer bypassing our treatments and getting resistant. So this is another important thing that I wanted to emphasize, is that that the chronic stress not only increases inflammation, but it decreases cellular immunity. And cellular immunity is what we need to eliminate cancer cells. We think that each one of us is producing little cancers because we're exposed to these carcinogens. So we're producing little cancer throughout our life. But if our immune system is, if our internal system is in balance and our immune system is able to detect those cells and eliminate them, then we don't get the clinical diagnosis of cancer. And this is shown by some studies where, for example, from people that died from accidents, from car accidents. And in a significant 11% of the patients in one study did, in their autopsies, they did find small cancers. So they were living with their cancers without knowing, but their their immune system were keeping them in check. And there's other studies in mammographies that suggest that even our immune system helps to eliminate some small breast cancers. So, and I'm talking always about a small volume disease. So chronic stress enhances inflammation and decreases our cellular immunity. So it inhibits the ability of our own immune system to deal with that cancer. Yeah, as Dr. Ranjan says here, no treatment can be totally successful unless it tackles chronic stress levels completely. So this psychoneuroimmunology, it's this way of looking at medicine in a different way. And this is only from the 1980s. It was the first time that we started talking about psychoneuroimmunology. And really what it says, it's not a new specialty in medicine. It's a way of looking at medicine. As I mentioned before, we look at the same data, but from a different view, and understand how everything is interconnected. So as long as there's a stressor, then that stressor, and if it becomes chronic, then it will start affecting our endocrine system through all the HPA axis, etc. Our autonomic nervous system, our immune system, and they all work together. So if we have a stressor that is affecting any of these, so here I meant to explain with the red arrows, so any aggression that affects each one of the levels of the system will be affecting the whole PNI system. And here we see how our lifestyle, through psychosocial stress, through environmental pollution, through poor sleep, poor diet, sedentarism, it's affecting the whole system. So this cartoon shows very well that even if a cell gets an initial alteration through a carcinogen, here we see in this arrow, something initiates a cell turning from normal cell to mutated cell. The evolution of that cell and whether it will produce or not a tumor, it depends on the response of the immune system. If that immune system is working properly, it will activate T and B lymphocytes, and it will mount a tumor response that it will inhibit that tumor progression, that formation of the tumor. But so it will inhibit the tumor. But if that person is living under chronic stress and has a chronic inflammation, the main reaction will be an inflammatory response that not only it will not avoid the formation of the tumor, but it will promote the growth of the tumor, because we know that an inflammatory reaction nowadays will promote cell division and angiogenesis and a chemistry that will allow growth and expansion and malignant conversion of that tumor. So the problem is not completely on that initial cell that got mutated, but how the immune system responded to it, and whether it eliminated that initial tumor cells or whether it promoted that tumor to grow. So this is exactly what PNI tells us, that psychological factors, and especially life demands, but also how we perceive stress. And this is an important part. Today, we do have sources of stress. We all have now with the pandemic, but apart from that, we all have our own job demands or family demands or etc. But the problem is also how we perceive stress. So as long as we cannot regulate ourselves and we are in fear or we are in worry, we might see stress and difficulties where they're not. And that adds more stress. So the perceived stress will activate the HPA axis and the autonomic nervous system, and through the chemistry of the cortisol, adrenaline, noradrenaline, will affect directly the tumor microenvironment. So if in chronic stress or in chronic social isolation or socioeconomic burden, one person might be in chronic activation of these two axes and might be allowing that tumor to continue to grow and expand. So there's plenty of articles that explain in a more detailed way exactly how this happens. And here I leave some of the papers that talk about stress inhibiting other areas, not only the DNA repair mechanisms or activating the inflammation in deprivation of the cellular immunity, but for example, how hydrocortisone will downregulate the tumor suppressor genes, so allowing the oncogenes to go forward, or evidence of how markers of inflammation are associated with reduced survival in breast cancer patients, in lung cancer patients. So there's plenty of evidence. As I say, there will never be a study, a prospective randomized controlled study, stressing half of the population and not stressing the other to see what the effect is. So obviously all the information comes from more indirect data. From epidemiologic studies, from translational studies. So I always quote your sage Krishnamurti, who referred to this adaptive mechanism we have, but he warned us that it is no measure of health to be well adjusted to a profoundly sick society. So we keep on trying to use our adaptive mechanism to adapt to a society that is crazy, in the sense that is treating us as part of an industrial part of the industrial chain, and making us work and demand more of ourselves, and not let us live a life where we can also enjoy and grow our spiritual selves, and let us time and energy and focus to develop ourselves as human beings, to flourish all our talents, to bring whatever we came to bring to this world. Each one of us in a most unique way, we came to flower and give our perfume. And this is our main purpose of life. It's not becoming a worker that produces and produces. So very clearly, Krishnamurti put this into this nice way of explaining it. So just to emphasize, what we nowadays know is that cancer may be initiated by some genetic damage, by some mutation. But as these authors say, the genetic damage may be like the match that lights the fire, but the fire won't keep going if there's no fuel that feeds the fire. So it is inflammation that provides the fuel that feeds the flames. And what is the inflammation nowadays? Well, nowadays, even if we have contact with one carcinogen that produces a mutation, what keeps that flames going is precisely what I've mentioned before. It's our lifestyle. There's plenty of evidence how poor nutrition can augment inflammation, how sedentarism augments inflammation. And maybe it's not the same in your country, but in our country, we're very much, sitting down in our jobs, in our desks, at our computers, on the bus, on the car. So we're sitting down all the time. We're not, walking anymore, or we're walking very little in some cities. But some places are completely depending on public bus or cars. So we're not, moving. So poor sleep, that's another stress, brings insomnia and sleep difficulties, and that's the feedback loop that augments inflammation. Also emotional distress, and nowadays with so much demand, we're not educated on how to deal with our emotions, at least in our Western world. So there's a lot of mistreatment, a lot of violence. Not only, I'm not saying always physical, but a lot of verbal violence. Today, we're seeing a lot of verbal violence in the streets. So that also activates our HPA axis. It activates the same axis, the stress response, and obviously stress. So what keeps the flames going, it's all our lifestyle and how we're living. And this is what keeps the flames and the cancer growing. So as Dr. Ranjan mentioned in the chat, there's no way that we can deal with a disease if we cannot totally successfully tackle the chronic stress level. Yeah. So I'm sorry to hear that most Indian are becoming sedentary as well. Yeah, that's a problem. Yeah. Okay. Thank you, Jasbir Bhatia, asking, Madam, does some innate hatred of the self aggravate? Completely. I will mention that, how the emotions and not well channeled emotions can also add to that stress and to that inflammation. So I see. So in this view, what we see is that we've been looking at cancer, like looking at the arms of the clock and thinking that we understand what the time is or what the problem is. And it's only when we put the cancer in this context that we understand that in this case, it's another time. So only when we understand the cancer in the midst of how the immune system is responding and how that immune system depends on this whole network, inner network that we have, the psychoneuroimmunology network that will modify on how that immune system will be able to respond when detecting a mutated cell. So this is from a book I wrote with a psychologist here in our neighbor country, Uruguay. No, this is from my book. Okay, I put it also in Cancer as a Wake-Up Call. So now we're understanding cancer not only as a growth of those mutated cells that grow without control, but cancer is a term of diseases in which, in the context of a PNI network that it's not functioning optimally, and the DNA repair mechanisms which are altered, then the abnormal cells are able to divide and invade and etc., etc. But we need to put this in the context. So why is this important? Because it will allow us to design a treatment that it's a more broad treatment, like Dr. Ranjan was mentioning, and here's an excellent review paper for this information. And this is Eben Alexander, a neurosurgeon in Harvard, who had himself an experience, a personal experience, and is talking on how this model, this pure materialistic science will go the way, will go away the same as we stop believing that the earth was flat. So I recommend to look at his YouTube videos or his book. It's very interesting. So looking at integrative oncology from this PNI basis, when we assess a patient, we will not only look at the biology of the patient and look at their their CT scans and their lab results and examine the patient. We will also ask the patient how or she eats, what he eats, how, you know, how he keeps weight, if he or she does exercise, how or she sleeps. So all these lifestyle habits. But we will also ask the patient how he thinks, you know, what are the thoughts that are ruminating in his or her head, or how he deals with emotions. Like someone here is saying, no university teaches self-love. Of course. So how does that person deals with negative emotions, and how does person cultivates positive emotions? So this will affect his health. And then the socioecologic, which environment that person is in, at home, at work, within his friends, also the physical environment, that is this person enough in contact with nature or not? And the spiritual level, is this person really connected to what is important for him or her in life, to what gives meaning to their life? We all know of cases who, after a loved one died, and 3 months later, the loved one died without having any previous diagnosis. So there is some spiritual connection. When we lose our main focus, our main meaning, our main purpose in life, we may become sick, and very, very rapidly. So therefore, integrative oncology, we will attend not only the physical needs, but also the psychospiritual needs and the social needs. And this is a slide from Lorenzo Cohen, which is the head of integrative oncology at MD Anderson Cancer Center. And as we can see, there is a myriad of treatments. It's not only surgery and chemotherapy and radiation therapy, but a whole myriad of treatments that will affect the health of that person and might help him or her to recover health after a diagnosis. So we need to understand which is needed for every person. Not everybody needs everything, but what is needed for everyone. And this is a paper that in 2018, it is only in 2019, that the ASCO, the American Society of Clinical Oncology, endorsed and accepted the Integrative Oncology Guidelines. The Integrative Oncology Society was founded in 2003. And what they did is they started publishing these guidelines, where they show all these complementary treatments like acupuncture, meditation, yoga, and what's the evidence of whether they're safe for the oncologic patients and whether they are effective to reduce some symptom or to improve recurrence-free survival, etc. So this is an excellent paper where it reviews more than 200 randomized studies and shows what level of evidence there is to use acupuncture or reflexology or yoga. So there's plenty of evidence to use meditation and yoga and acupuncture in cancer patients. So basically, this when we see a patient through the integrative oncology eyes, the treatment will be the medical treatment, surgery or chemotherapy, hormonal therapy, whatever is really needed. And plus, we will help that patient recover their health. How? Through good nutrition, keeping a good weight, exercising, good sleep, understanding how to deal with stress, and also how to auto-regulate, because we all have stressors in our life, but how to respond to them and how to come back to a balanced system inside. And of course, all the social support and promoting the positive emotions, it's part of the healing, and avoiding environmental exposure. So just here some few slides to show that there is evidence, and solid evidence, of how diet helps. And nowadays there's a strong interest in seeing how diet will affect all this microbiome within our gut, and will affect our health, but also it will affect how we respond to certain therapies like immune therapy or hormonal therapy, which means that nowadays it's important to know what a patient, how he or she is eating, because if we are going to give some hormonal therapy or some immune therapy, we need that their gut is in good health, otherwise it might not be a good response. So it's part of the treatment. For all that are herbs or supplements, I usually consult this Memorial Sloan Kettering Cancer Center database, which is an excellent database. There's so for each of the elements, if you put ginseng or turmeric or whatever you want to put, and it will be an explanation of the compound for in lay language or for medical professionals, and levels of evidence, and for what is being used, etc., and cautions to have. Obviously, we'll advise the patient to exercise. If it's in nature, it's even better. There's data now showing that forest bathing, it's very good for health. Sleeping is extremely important. I could talk half an hour about sleep, and how sleep activates that that parasympathetic system, and helps us to come back to balance. And obviously, all these, many of these practices that we really owe to you and your wisdom, because for us they all come from our East, from India, and also some from China, but very much from India, meditation and yoga. So all these practices that help us to auto-regulate, to induce our relaxation response, improve our parasympathetic system, and bring us back to balance, bring us back to health. I here added my Spotify and YouTube channel. I have some meditations recorded, also in English, and so people can take a meditation from there. So here's just to show how the relaxation response induces a chemistry that it counteracts all the stress chemistry. So that is why we need to do all these exercises and practices to improve our chemistry inside. And also some other therapies like massage therapy, which has been proven that with some precautions, they can be done in cancer patients. And even acupuncture, which it was doubted whether it could be used safely in cancer patients, there are studies that show that it can, and it does help for a lot of the symptoms promoted by a lot of the side effects of chemotherapy or of the disease, or symptoms of the disease in itself. So yes, acupuncture is safe. And also what my way of practicing integrative oncology, I apart from all these practices, I do recommend the patients to really take time to get to know themselves, usually with a psychotherapist, an integrative psychotherapist, and to also look for social support. Today we know that isolation brings us, increases death. So we need to open up and look for support. Our major way of dealing with stress is through social support, and that's physiologically. I'll show you a slide. So for that, they need to go through some type of therapy that will teach them how to become more resilient, because stressors will come back, or will come, there will be new stressors, but how to deal with the stress and how to go back to balance again. And this is, someone was saying, yeah, they don't teach us love, But now we're having data how positive emotions, how a big hug increases oxytocin and decreases cortisol. You know, we're seeing the correlation between positive emotions, our inner chemistry. So, and this just for the ones who need more hard data, just to tell you that there's at least 2 trials, randomized controlled prospective trials, well done methodologically, that do prove that this integrative approach decreases recurrence and improves survival in cancer patients. And there's one trial, this one from the Ohio group by Barbara Anderson, where 227 patients, breast cancer patients, they initially got the treatment they needed, like surgery, radiation therapy, hormone chemotherapy if needed. And then they were either followed in a conventional way or followed for 1 year, the first 3 months in an intensive way, teaching them good nutrition and exercise and relaxation response and looking for social support and dealing with stresses in life. And the group that was accompanied this intensively, the 3 months and then once a month for the rest of the year, they had increased recurrence-free survival and increased breast cancer specific survival and an increased overall survival. So, and this is a follow-up of 11 months. So this is a well done trial that shows improved recurrence-free and overall survival. And this is a second group, also with 11 years of follow-up by the group of Antoni, and a similar trial in breast cancer patients, also showing an improvement. So I don't know how much time we have left, but I wanted to mention one more aspect.
We have ample time, Dr. Laura.
We have ample time. Okay. I was reading the questions there. I'll go back to that. So one more aspect that I want to add is that integrative oncology nowadays is something that is evolving. Yes, we're starting to understand that we have to broaden the view to include all these lifestyle changes, all the stress control in order to tackle any disease. We cannot just go, shutting down the symptoms, palliating the symptoms, and not treating the root cause. So there's many approaches in integrative medicine and integrative oncology that mostly include nutrition and exercise and stress reduction and psychosocial measures and sleep, like I mentioned. But my main interest nowadays is how to tailor these treatments and these practices to every patient, because not everybody needs the same. Not everybody needs the same type of exercise. I use this metaphor. If we're talking about electricity, and one person is like a 120 watts light bulb, and another one is a 40 bulbs, they won't need the same type of exercises, the same type of discharge. There are some people that need more active, more exercise, that it's more that will discharge more, and other people with just walking 30 minutes a day will be fine. So that's for the exercise. But the same for meditation. There's people that can sit down and just relax and calm their mind. And some people, their mind is going like so fast that they will need more of an active meditation in order to bring, it's like if you're listening to rock music, or I don't know, I'm thinking about one of your rajas, like very high up, and you want to bring someone down. It's very difficult to bring it from, to let them listen to very slow music all of a sudden. Usually, if you slow down a little bit, then you can go slowing down. So the same with meditation. Some people will need more active meditation until they slow down a little bit, and then they can go into more deeper meditation. So the tailored part for me, it's very important. And one of the things I look into is looking at the real nature of the person. Traditionally, even in our Western culture, we used to talk about the 4 elements or the 4 ways of energy is packed in our body. You know, if we are more earthy, that's our more solid part, you know, more pragmatic, more down to earth. But if we're more watery, we're more linked to emotions. If we're more air, we're more in our heads probably. And if we're more fire, we're more in the impulse. So it depends on what type of personality, but it's not about personality comes from our own essence and how we were brought up, experiences in life that were molding us. So how that person came to be, it's very important to see what type of exercise, what type of nutrition, what type of practices will be recommended for he or she in order to balance. I know you in India, you have your Ayurvedic medicine, which is based on the same principles. And in the West, we have, in the beginning of medicine, Hippocrates and the Greeks used to base on this elemental nature, but then we lost it. And I think it's time to come back to really see each person and what's their essence and how they're living a life that is according to their essence, or they have deviated much from the path. Because what I see, it's a lot of patients getting ill, and illness is a way of telling the body, telling the person, just come back to your essence, come back to who you are, come back to live a life that it has meaning for you, that it's according to who you are. Don't try to be a rose if you were born to be Marguerite, how do you call another flower in English? A lotus flower. So don't try to be a marigold. So don't try to be a rose if you were born to be a marigold, or the other way around. Just be who you are. So this is very important. And I think we need to bring this, in medicine. We need to bring this knowledge of who the person is and what got that person sick. So another thing that it's not well documented in Western medicine, it's all our bioenergetic field. And I'm not talking about something esoteric. I'm talking about what our energy that composes us, our thoughts, our electrical impulses in our brain. So we know they are part of our energetic system. Our thoughts, our emotions, when we feel an emotion, we get activated by happiness. This is energy flowing within us. Okay, this is what I'm talking about. How our thoughts, our emotions, our spiritual, our desires, our values, how they keep us lightened up or not, and how we are able to let that energy flow through us. Is it, flowing freely, or is it getting stuck because I have a thought, but then I have some limitations, some external rule that is telling me you shouldn't be thinking that, or you shouldn't be feeling that, and then emotion gets stuck. So all these energetic parts that I know in your culture and in Asia in general, in Japan, in China, in India, they have much more this integrated in the everyday life, this energy, and how we are energetically, even if we're not touching. Now we're not touching each other with the COVID, but how we are affecting each other even without touching. So we need to understand the bioenergetic field. We need to understand how our emotions affect our body and affect our chemistry, and this is very important. So someone was saying there, they don't teach us love. Of course, if you see in happiness or in love, the whole body gets activated, full of energy, active to do whatever we want to do, and on the contrary, if we are depressed, we are completely deprived from energy. So how the emotions do affect our biology and our chemistry, and how to learn how to deal with emotions so they don't get stuck and they don't get against our biology. And I do use also the wisdom that comes from your yoga and the chakra system, because Western medicine doesn't explain why a woman, a 50-year-old, gets breast cancer and another one gets a cervical cancer or a brain cancer. I mean, we don't have any idea. We just say genetics, and we know that genetics is just one factor. So understanding how the emotions affect our body and how they allow or not our chakras to continue spinning the energy around. So that gives us a guide of why someone with breast cancer may be having some trouble with their fourth chakra, you know, and their heart problems and their problems of relation and love and problems with their loved ones. You know, I'm not saying that every time is like that, but if I see a patient either with a breast cancer or with a heart attack, we know that heart attacks are more related to emotional disgraces. So let's start thinking about cancer in the same way. Someone with breast cancer, okay, what's going on in that love life of that person, you know, and how to help that person to get their love flowing again, and the self-love, like someone mentioned, in order to regain health. And this is also I want to mention, because it's I'm very investigating this area, which is also very interesting. It's the way we are dealing with stress and responding to stress may be already programmed since our childhood. Because in our autonomic nervous system, I talked about the gas pedal and the brake, like I was talking mostly about the sympathetic, it's the gas pedal, and the brake will be the parasympathetic. But we know now that the parasympathetic has two branches, the vagus nerve, which is the main nerve that innervates, that distributes all the parasympathetic system, has two branches and has more of a dorsal vagus nerve that innervates the infradiaphragmatic body, and a ventral vagal that innervates mostly our face and or our neck and head. And what this involves is that in front of a stress, someone may have this typical fight or flight reaction, which is more sympathetic. But some people, because of of early life experiences, may have been caught in this dorsal vagal way of dealing with stress, which means that they get frozen, or they get or they even get affected all their infradiaphragmatic area, and they get diarrhea, for example. So this is in the phylogenetic evolution of this adaptive system. The dorsal vagal is like the fish of the cold waters that in front of a stress, they would get immobilized and put down their temperature so they're not detected. So this is the same type of freeze type of mechanism that some people have, and it's the worst for health. So if we detect people that are dealing with stress in this way, we need to re-educate their autonomic nervous system so they get a more evolved type of response, like a sympathetic fight or flight response, or the most type of evolved response to stress, which is looking for social support. We are tuned, we are equipped with a system that the best way to deal with stress is looking for others and looking for help for others. So, and this we know because through our gestures in our face, even from different cultures and not talking the same language, we can see when someone is in stress, when someone is afraid, when someone is in love. So we can smile and let the other one smile. We can share these through these social gestures. So very important to understand how that person auto-regulates, what tools he or she has, how she's been grown up, and how she responds in which area of the ladder responds to this type of stress. So I was going to start ending my talk through a couple of cases. I don't know if there's any other questions. I'm looking here if there's other questions. How do
There
you
are few
like
questions, Dr. Laura, but after these examples, we can take those questions.
Okay. So this is just a few examples that I took from my practice. And in the same week, I had these two patients. One was a 43-year-old, but I talk in past because I saw her at that time. 43-year-old premenopausal woman who, in a control mammogram, she was found to have a very small invasive carcinoma. She underwent surgery, and it was detected to be a 6-millimeter invasive carcinoma. They took out 2 lymph nodes, which were both negative for metastasis. And in the immunohistochemistry, it showed that it was a hormone-dependent estrogen and progesterone positive cancer with a negative HER2/neu receptor and a low Ki65 proliferation marker. So according to the international guidelines, how this person would be treated is with conservative surgery plus radiation therapy plus 5 to 10 years of some type of hormonal therapy. It might be tamoxifen, it might be another one. But this is patient 1. So, and then on the same week, I saw this 37-year-old patient, also premenopausal, also in a control mammogram. She was found to have ductal carcinoma in situ, but with some foci of invasion. So it's considered an invasive, microinvasive carcinoma with also negative lymph nodes, hormone dependent as well, and a low proliferation rate. So again, this person, according to conventional guidelines, to international guidelines, would be treated the same way. Now, as you see from conventional treatment, there's very little difference between these two patients. Now, when we go to evaluating this person's from all their other dimensions, from their cognitive dimension, how is this person thinking? How is her emotional status? What type of support she has? Is she connected to what has meaning in her life? So we see that patient 1, she had obese. She was obese, and she was really very sedentary, not eating well, sleeping well, but not really eating very well nor exercising. And she was someone who was she was always stressed because she had to take care of the whole family, and she was taking care of the children and taking care of the husband and taking care of the home and really putting everything on her back. And when I asked her about emotionally, she said that her conflicts were mostly with her mother and her sister, with whom she had a close relationships, but because she was so dedicated to her family, she didn't have any time to make friends. And she didn't feel good with herself. So she didn't look for a job because she thought that if she went to an interview and they saw that she was so obese and she couldn't take care of herself, they would think poorly of her. So this affected even her social way of handling. And her meaning, when I asked her about meaning in life, she said, I don't have time for that. I have to take care of my family. So clearly here, this person will need some type of support that will be different from this second patient, that even though they needed the same medical treatment, this second patient, she was a very fit person, exercised daily, very healthy diet, so healthy that she was a little bit too strict with herself. And she told me she would sleep very little because she was adamant that she had to wake up in the morning and make the lunch boxes for her children, and they had to be freshly made. And so she would sleep less in order to be have an excellent diet and excellent meditation practice. So she was so self-demanding that she lived a very strict life with herself, very demanding herself. And again, she had no time for social activities and dedicated a lot to her job and to living a very rigorous life. And her main clash inside was that she was wishing to get pregnant again, and she wouldn't get pregnant. So she had another concern and an extra stressor in her life. So we see that these two patients, even if they needed the same surgery and radiation therapy and everything, patient one will need much more stress on a good diet, on losing weight, on exercising daily, and to learning how to meditate. Those would be all interventions that will decrease their inflammation status within her. Obviously, I also recommended some psychotherapy with some integrative psychotherapies that would help her start putting safe limits, start taking care of herself, cultivating this self-love, and looking for something that really, apart from her family, that had meaning in her life. So, and patient two, she had a good lifestyle habits. Maybe she needed to learn how to sleep more and the importance of sleep, and that it was better to sleep more and not have an excellent, completely rigorous diet, but yes, sleep better. And her psychotherapy would be more geared towards knowing how to accept herself, to have self-compassion, to not be so rigorous, etc., etc. So from the integrative point of view, these two patients would have a different type of approach, even though from the medical view, they would have the same. And what I see in my clinic is that patients like this, they do have a good response. I'm not able to quantify them because I didn't do a prospective trial. All I have is anecdotes, and anecdotes cannot be published, in medicine like this with a certain level of certainty. All I can say is what I see in my clinic. And for example, I brought this case, which is a very dear friend, a very dear patient of mine, which I follow now for 5 years. And she was 52 when she came to see me, and she had a history of migraine and hypertension. And she had been found to have an invasive cancer in 2014, which was hormone independent, but HER2 positive, and she had several lymph nodes positive. So she had an advanced locally advanced breast cancer. And at that time, she followed just conventional treatment and did well only for 2 years. And 2 years after, she was found to have lung metastasis. So there she started some systemic chemotherapy with immunotherapy, and she came to see me. And when I saw her, she was a very, very stressed woman. She had a very demanding job. She took it very in a self-demanding way. And plus she had a home with 5 kids and a husband who was very dedicated to his job. So she also took all the burden of the household and the kids. And she was really living for the last years. She was living a very stressful life. So, and she was very unhappy and she was exhausted. So we started working and with all the integrative approach, not only lifestyle changes to start taking better care of herself, but also with a psychotherapist to start making some important changes. And she did them. She changed her, she quit her job. She asked for an early retirement. She started cooking, which was something new for her. She was so enthusiastic about healthy eating. She said, I want to share this with other people. So she started her small enterprise of healthy cooking and selling this for others. And she was able to put much more limits with her husband and her children, asking him to help more, asking the elder children also to help more in the house. So in a few months, she was able to decrease her level of stress significantly and start enjoying more. And she participated in one of the workshops I do, which is based on this clinical trial I showed you, that for 3 months on a weekly basis, the patients are taught how to eat better and how to exercise and how to meditate and how to deal with emotions and to search for meaning and etc. And she did that workshop, and she really made a big change in her life, and she found a group of support, because in this workshop she also found other women who were looking for same type of change in their lifestyle. And sometimes it's very difficult because people in their families don't follow with them, so finding others that are also motivated to make significant changes gives them this group support. So she's been doing very well. She has been now with no evidence of disease for 5 years. She's living much more happily. She's telling everybody about this integrative approach. She even gave my book to her doctor oncologist, who then asked me to give a lecture. And then thanks to that, we started a small commission of integrative oncology in our local oncology association. So, I mean, this woman has moved a lot, not for herself, but for others as well. So it's a really nice example of how someone can flourish for themselves and for others. Of course, she's with no evidence of disease, but she's also doing the medical treatment. She's continued only in immunotherapy as a maintenance immunotherapy, but all her CAT scans are free now, are clean now. How she will continue, we don't know. But in the meantime, she's living a much happier life and very healthy. And of course, we hope that she will continue healthy and happy for many, many, many years to come. And this is what is happening now in oncology. People who are doing something else apart from their treatment are beating the odds. They are living longer, they are living with less recurrence. And this has been shown in this book and docuseries that you mentioned as well, this Radical Remission of Dr. KellyATurner. She interviews a lot of patients who are beating the odds. And also Dr. Marius Wirga in South California, he also has a program of beating the odds, which is precisely that, helping people to live better and beating the medical odds. So this is happening. So let me just go on finishing, and before the questions, it is my wish that this epidemic of cancer, whether you're dealing with cancer as a self-diagnosis, going through treatment, or accompanying someone, or whether you're a physician who's dealing with patients with cancer, I hope that cancer is a wake-up call for all of us, that it allows us to stop and become aware of how we're living, what is making us good, what is not making us good, what is really enlightening me and making me flourish, and start living a life that it's more conscious, it's more driven from the inside, and that we're all able to blossom the flowers that we came to be, and give our perfume for us and for the others around us. So this is my intention for all of us. So thank you very much, and I'll be happy to take any questions.
Thank you, Dr. Laura. This was really, really, really very informative and transformative session. And one question from my side is that this integrative oncology, integrative medicine is the future of the medicine. And yes, a lot of doctors are following this. With this, right now, Dr. Gautam is also here. He is also oncologist from India, and he was a speaker also. That what you see in how much time it will take that these whole knowledge, that integrated knowledge, will be taught in the medical schools and other places, so that everyone can be benefited. And there should be some protocols that these things work. One should consider it on the health, one should consider on the diet, nutrition, exercise, and other things.
So I think, now we live in a world, in a quantum world. So, and according to the chaos theory, little changes can make big big, little movements can make big changes. I think it is not predictable of how long it will take. I know things are moving, I know that's why I mentioned, I know you are doing this movement in your home country. I'm here from Argentina. We are a few in Argentina. This is not the gold standard in Argentina, but in America, there are some people, in Canada, there are some people, in Europe, there are some people. So I feel that this change is coming. And from one, like Kierkegaard, a Danish philosopher said, at first a new idea is opposed and it's treated as, as
rejected.
But then, and then it's resisted. First is opposed, then it's resisted, and then from one day to another, it is accepted as if it was obvious that this is the new model, the new way. So I believe that this can happen because people are looking for this. The amount of people that are looking for a new way of seeing medicine, I see it in the social media. I do this weekly podcasts in Instagram or these YouTube videos, and so you're all welcome to come to share some of those podcasts and interviews, and I think this work that you are doing, that I'm doing, that we are doing, I think if we connect each other, in network, we will be able to make this change. Yes. How long? I don't know. But in the last few years, I tell you, I give now a talk to pre-med students, so people who are still not doctors. So that's a big gain. So start, from the beginning. And patients are looking for this. So I feel this is coming. This is not the future medicine. This is the current medicine. Only that few people know about it. Yeah. But this is the modern, the more modern medicine. But it's only that still few people know about it. But it is growing. It is growing.